Hello, I'm Matthew Weinstock with Hospitals and Health Networks. The 17th annual Most Wired Survey and Benchmark Study opened to the field on January 15th. This is a brand new era for the Most Wired Survey, and we're very excited here at HNHN and the AHA. As some of you may know, back in October, we announced a new partnership with the College of Healthcare Information Management Executives, or CHIME, around the Most Wired Survey. The goal is to really broaden the reach of Most Wired and to strengthen its impact on the field. I'm joined right now by my colleague Susanna Hapsalern, who's our senior editor for data and research, and really the brains behind Most Wired here at HNHN, to talk about the 2015 survey, what we're hoping to see in that survey, and some of the trends that may come out of it. Susanna, thanks for being with me.
Thank you, Matthew.
So Susanna, let's jump into the survey first. This year is the first year that we're actually asking hospitals if they've attested successfully to meaningful use stage 1 and or stage 2. Why is that important for the survey?
We're adding these extra verifications and validations to really secure our knowledge of what is in the database. Audits are very important for validity. And I want to emphasize that over time, we've been increasing the number of meaningful use requirements that are important to achieve Most Wired status. But that's not the only measures that we employ in the program. In the program, we're really looking at a broad base of capabilities across 4 focus areas. So we're looking at disaster recovery capabilities, strict security protocols, automation in the supply chain and revenue cycle, patient flow, and connectivity across the continuum in a different way. So all those measures are taken into account to achieve Most Wired status.
This year's survey, along with those meaningful use questions, there's an expanded section on patient and family engagement, which we know is becoming increasingly important in the healthcare field, especially as we move to sort of a value-based system. Are there trends that you think or that you hope you'll see in that part of the survey?
We're very excited about the new section on patient and family engagement. We're looking at how technology can be used in the hospital, outside of the hospital, and on an ongoing basis with the care team. So the patient and the family are in a constant learning and interaction mode. Those tools already exist, and we want to see how hospitals are using them, if they're using them, and if they are really monitoring what they're doing with those tools, how they're learning from them. Are they changing their interactions? As we move towards population health, the most important aspect is to consider that patient and family as part of that care team. And technology can make that happen on an ongoing basis.
Well, and another key piece we're seeing in that patient engagement part, right, is transparency, because patients are becoming more involved in wanting to know what's going on in their care, how much care costs, what kind of quality they're receiving. So talk a little bit about the expanded section we have on transparency in the survey.
We added a question on open notes in the patient portal. A lot of patients don't understand what their clinician is saying to them about their condition, what they need to be doing. So we're talking about really providing that information in plain language so that everybody can be on the same page. This is important for that continuing dialogue. And in the past, we've seen tremendous progress on quality reporting. So most organizations already are very transparent about their quality scores, what they're doing to improve quality. And many have made strong inroads in being transparent about the cost of care so that you know when you come to the organization what it's going to cost you to undergo a certain procedure.
Susanna, another hot button issue that we're seeing, not just in healthcare, but across the globe really, is cybersecurity, with all the data breaches we've had dating back to Target and Home Depot, even the Pentagon and White House most recently. We've added some new questions around cybersecurity. Can you talk about the importance of taking a close look at what hospitals are doing on the security front?
Cybersecurity is a moving target. So we're quickly adapting techniques and learning from other industries. This year, we've added a number of assessments and technologies that hospitals can employ to really make sure that they are keeping up. We've also added some questions on governance of cybersecurity. What's the board involvement? Do we have some insurance? So we're not caught off guard. And these are all areas that will help to strengthen us in the future.
And lastly, Susanna, as I mentioned earlier, this is a brand new era for Most Wired. Very exciting for us here at HNHN and the AHA with the partnership with Chime. Talk a little bit about what you hope to see as that partnership evolves and Most Wired evolves over the next couple of years.
Chime and AHA's Health Forum have made a commitment to this next generation of Most Wired. That means going into value-based care, care across the continuum, population health. And we know that that's going to take a different sort of analytics, a different look at ourselves and learning from what's going on in the field, the best practices. Over the years, we've seen tremendous progress in the use of IT to improve quality of care and patient safety. So now we're putting the best group together to really tackle the challenges that are facing us in the future.
Susanna, thanks for talking to me today about the survey.
Thank you, Matthew.
And as I mentioned, the Most Wired survey is now open for all hospitals and health systems to take. You can reach it from the Health Forum website, that's healthforum.com, and click on the Most Wired button there. The survey is open until March 15th. We really encourage as many hospitals and health systems across the country to take the survey to assess how your IT strategy is stacking up against the field. And also look for ongoing coverage of the Most Wired survey in every issue of HNHN. I'm Matthew Weinstock. Thanks for tuning in.